In the past, bed rest was actually considered the best medicine. Doctors would advise you to stay lying down until the pain subsided. Today, however, it has been proven that is a misconception. Total immobility only makes the problem worse. Muscles weaken, circulation deteriorates, and the nutrient supply to your spinal discs diminishes. Movement is the natural lubricant for your joints. In the case of acute pain, an injury, or a bruise, the rule for the first 48 hours is: use cold compresses, such as ice wrapped in a towel. This helps to reduce swelling and alleviate inflammation. From the third or fourth day, you can transition to heat. Hot water bottles or warm baths relax the muscles and release tension. Most importantly, return to light, everyday activity as soon as possible. Walking and gentle stretching promote recovery significantly faster than lying in front of the TV. Another important point: on average, a human head weighs about 4 to 5 kilograms. However, when you tilt it toward a smartphone, the strain on your cervical spine can soar to as much as 27 kilograms. Therefore, hold your phone at eye level as much as possible. Do not bend your head toward the display. Fascinating fact: children are born with 33 vertebrae, while adults have only 24. Why? Over time, the lower vertebrae fuse together to form the sacrum and the tailbone. Many people panicked the moment they read the words herniated disc on their MRI report. But in reality, the situation is rarely as dire as it sounds. Most cases resolve on their own within 6 to 12 weeks, or the inflammation simply subsides. What's more, plenty of people live with a herniated disc without even realizing it, because they feel no pain at all. You see, the pain isn't caused by the herniation itself, but rather occurs when the tissue begins to press against a nerve root. When it comes to treatment, over 90% of all back pain cases can be successfully managed without surgery, through physiotherapy, targeted exercise, medication, and lifestyle adjustments. And here is another widespread misconception: the idea that a herniated disc or shifted vertebrae can simply be popped back into place by hand. Physically, that is impossible. Actual vertebral slippage is extremely rare. A herniated disc is actually a tear in the outer ring of the disc, allowing the high-pressure core to bulge outward. Neither a massage therapist nor a manual therapist can simply push this tissue back in. Even the term slipped vertebra is mostly used incorrectly. Usually, we are dealing with muscular tension rather than an actual misalignment of the bones. Choosing the right mattress is a highly individual matter. A sleeping surface that is too firm prevents the spine from maintaining its natural position, which in turn stops the muscles from fully relaxing. The ideal mattress should provide straight support for the spine while adapting to its natural curves. In most cases, a medium level of firmness proves to be the optimal choice. And here is another crucial point. When your back hurts, it does not necessarily mean there is physical damage. Pain is not always an indicator of a defect. Rather, it is an alarm signal from the brain that can also be triggered by stress, lack of sleep, or exhaustion, even when the spinal tissue is perfectly intact. The intensity of the pain is not necessarily linked to the degree of wear and tear. Sometimes, even minor issues can cause significant discomfort, while severe damage can remain virtually painless. Many people rush straight for an MRI at the very first sign of lumbago. Yet, herein lies the paradox. Bulges, herniated discs, or misalignments are frequently found even in people who have never once complained of back trouble. An imaging finding simply doesn't always explain the pain. You can think of it like wrinkles, only on the inside. Almost everyone has these signs of aging, and they are by no means always the actual source of the discomfort. An MRI is undoubtedly important, but please, only when clearly indicated. For instance, if there is a suspicion of serious injury, infection, or tumors, or if the pain refuses to subside despite weeks of conservative treatment. All too often, the scan reveals abnormalities that are, in truth, perfectly normal aging processes of the body and have absolutely nothing to do with the pain syndrome. Another essential point: be cautious with the constant use of supportive braces. They may provide short-term relief, but long-term use causes the muscles to weaken and slacken. They are a temporary aid, not a permanent solution. And don't forget to drink water. The spinal discs consist of about 80% water. When dehydrated, they lose their elasticity and are less able to cushion the impact of walking or running. The best method? Drink a glass of room temperature still water first thing in the morning and ensure adequate fluid intake throughout the day. This provides optimal support for your tissue function.
Back pain is arguably one of the most myth-shrouded subjects in medicine. Because this problem is so universal, countless legends and misconceptions have formed around it over the years. We tend to blame heavy bags or simply old age, but modern science sees it differently today. Most often, the pain arises from weak muscles, poor posture, and a sedentary lifestyle. A fascinating side note: you are actually a little taller in the morning than in the evening. Overnight, your spinal discs soak up water and expand in volume, only to be compressed again by your body weight during the day. It's for this very reason that astronauts gain several centimeters in height while in zero gravity. So, what truly helps, and what is actually counterproductive when your back hurts? We're here to clear up the most common myths.
From a young age, we're constantly told, sit up straight. But anyone who tries to keep their back permanently ramrod straight, or even stiff as a board, overstrains their muscles, causing them to fatigue much faster. The truth is, there's no such thing as a single, universally correct posture. A healthy spine has natural curves, which is why a relaxed slump is perfectly normal. What matters isn't a rigid position, but changing your posture regularly. The rule is simple. The best posture is always your next one. Our bodies thrive on movement, not static perfection. This principle holds true even during sleep. Lying on your side with your knees bent is often particularly gentle on the back. A pro tip: if you're a side sleeper, tuck a pillow between your knees. Prefer lying on your back? Then slide a bolster under your knees. It provides noticeable relief for the lower spine. The problem isn't lifting itself, but rather the technique involved. Those who hoist loads using their back instead of their legs are courting injury. Yet, therein lies the paradox. People who regularly work with weights, and do so correctly, often possess a stronger, more stable back. The spine is far from fragile. It is remarkably adaptable. Through progressive training, the lower back grows sturdier and the tissue more resilient. Safe technique is incredibly straightforward. Bend at the knees rather than curving the lumbar spine. Avoid lifting with your legs locked straight. Keep your back neutral, not rounded, and hold the load as close to your body as possible. Take care not to twist while carrying the weight. Make this movement second nature, even when you're just picking up an ordinary shopping bag. Back pain inevitably increases with age. It's a widespread concern, but the statistics tell a different story. The peak for back complaints is usually between the ages of 35 and 55. After that, the intensity of the problem often subsides for many people. Tissue wear and tear is a natural process, but it by no means necessarily leads to pain. Structural changes do not automatically mean your back is destined to cause you trouble. Your lifestyle is far more crucial. Regular physical activity and targeted muscle strengthening help prevent chronic pain at any age, or at the very least, significantly reduce the risk. Pay attention to your stress management. 2. Mental strain and anxiety increase muscle tension in the back and neck area. Deep breathing, relaxation techniques, or meditation often prove more effective than yet another pain-relieving ointment. Nordic walking, Pilates, yoga, or swimming. These are your best friends when dealing with an aching back. Hanging from a pull-up bar is a wildly popular, yet risky piece of advice. In theory, the idea of stretching the spine sounds perfectly logical. However, in practice, the sudden pull from your own body weight often triggers a reflexive, protective tension in the muscles. Instead of the hoped-for relief, you risk increased pain. Furthermore, excessive zeal can damage delicate nerve tissue. What the back truly needs is controlled, measured loading rather than aggressive stretching. Footwear also plays a decisive role. A completely flat sole, as found in sneakers or ballerina flats, is just as detrimental as high heels. The ideal is a stable heel of 2 to 4 centimeters, which provides the necessary cushioning when walking. Additionally, pay attention to the ergonomics of your workspace. Your monitor should be positioned at eye level so that you don't have to tilt your head. Make full use of your chair's backrest. And most importantly, stay dynamic. Change your position regularly, alternate between sitting upright, leaning back slightly, and working while standing at a height-adjustable desk. Take a short break every hour, stand up, have a good stretch, and walk a few steps. In the first few days following an acute flare-up, a massage, particularly if it's deep, tissue or heat-based, can actually do more harm than good. It stimulates blood flow to the inflamed area too vigorously, which often exacerbates both swelling and pain. While medical massage is certainly effective for loosening muscles and boosting circulation, it only truly makes sense once the acute phase has subsided, and it should always be performed by qualified professionals. In the long run, however, what truly matters isn't just loosening the body, but strengthening it in a targeted way. Strong abdominal and back muscles shoulder part of the load, effectively relieving pressure on your spine. To build this natural muscular corset, simple exercises like the plank or the bird dog are ideal. Start on all fours and extend the opposite arm and leg diagonally. To help prevent back pain, the use of a fascia ball is also recommended, a simple and effective method for releasing tension and improving spinal mobility. Genuine stability doesn't come from a masseur's hands. It comes from your own muscular system.
My concept is built on the fundamental idea that every life is unique and must not be allowed to vanish from history without a trace. It is the vision of a human heritage museum, a place where, at the very least, digital records of each individual are preserved, while for outstanding personalities, their personal belongings and works are also kept. The museum's flagship building will be dedicated to those who have profoundly shaped our civilization. But that is only the center. In every town and city across the globe, there will be local branches keeping the memory of all residents alive. This way, future generations can come to know you. The memory of anyone who has ever lived, and thus, yours as well, becomes imperishable. But for this, I need your guidance. In which country and in which city should this main building stand? And who deserves to be immortalized there? Perhaps even you. If so, write to me and tell me why. In my book, Human Heritage Museum, Foundations, I have detailed the idea of preserving the memory of every human being. You can find it right here.
While the diagnosis of osteochondrosis is widespread, it often proves to be a misjudgment. Studies show that degenerative changes in the spine, the very definition of osteochondrosis, occur in more than half of all people over 60. Remarkably, many of them remain completely pain-free. In fact, in about 85% of cases, there is no structural damage to the spine at all. The real causes are instead found in the muscles, ligaments, or joints. Consequently, injections and pills are not strictly necessary. Medication merely alleviates the symptoms, it puts out the fire, but it does nothing to change the lifestyle or movement habits that represent the actual root of the problem. The most effective approach is the combination of the realization that nothing catastrophic is happening and a gradual, well-founded physical rehabilitation. Incidentally, the notion that osteochondrosis is hereditary is also a myth. It is not the disease itself that is passed down, but merely a predisposition, such as specific characteristics of the connective tissue, metabolism, or vertebral structure. Whether these traits actually manifest depends significantly on your lifestyle, physical activity, and diet. If you are already experiencing pain, self-treatment and dubious methods are discouraged. Instead, opt for professional physiotherapy and be sure to consult a specialist if the discomfort persists for more than 5 days, radiates into the leg, or is accompanied by numbness and sensory disturbances. Leave us a like if you enjoy our videos, and subscribe to our channel so you don't miss any useful information.